Good morning, Dr. Barry G. Houston Stanton, psychiatrist. Wanted to talk with you all about a review article I read on TMS. TMS, which stands for repetitive transcranial magnetic stimulation, RTMS. Where is it used for? Good question. I'm glad y'all asked. It's used for people who have had failure of an antidepressant, sometimes and often multiple antidepressants. And what RTMS is, it's a way of using electromagnetic pulses to change electrical activity in the brain. So it's a way of stimulating electrical activity in the brain by using external electromagnetic magnets or pulses of electromagnetic energy on the outside of the skull, generating electrical changes on the inside. And it can be for a short area of the brain, meaning a small area of the brain, or a larger area of the brain. The most common area that's effective in treating in RTMS is the LPBC, which is the uh, left prefrontal cortex, the or left prefrontal cortex, most common area, but basically there are ways of assessing using a scalp electrode which is the desired area that one wants to treat and target with TMS. So want y'all to be aware of TMS, RTMS, little r capital TMS, repetitive transcranial magnetic stimulation as a possible treatment for patients, and it's been approved from age 15 to 85 for people who have failed antidepressants, lack of adequate response to antidepressants. Now, what you do want to keep in mind is what's nice about it is, from a safety profile, it's 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 not like taking a medication and that doesn't have the same side effects that frequently medication has. It can have side effects such as headaches, scalp irritation. There's a rare 1 in 30,000 instance of induction of a seizure. Uh, Possible induction of manic symptoms can occur, but in general, very safe, highly effective. Can be used also in geriatric patients, older patients who are frequently less likely to respond or tolerate antidepressants. So keep that in mind as a possible treatment. Felt to be very safe. What one has to keep in mind is the commitment involved. The standard treatment generally involves treatments every day of the week for several weeks. We'll talk about 25 to 30 to up to 36 treatments on a daily basis or multiple times a week until the treatments are rendered. So it is a commitment on the patient to go for a 30 to 40-minute treatment at multiple times a week, and one has to think about that. Insurances are paying for it these days, so that is frequently not as big a hang up as the commitment that it takes to get the treatment done. So just want to make y'all aware of this treatment and what do we think it's targeting. We think it's targeting something called neuroplasticity and synaptic density, which we think is part of and emotional regulation. So think about neuroplasticity, synaptic density, and also affecting emotional regulation and emotional modulation. These are target symptoms of TMS. Want y'all to keep that in mind as a possible treatment to talk with your clinician about. If you're someone like me who doesn't actually do the treatments themselves, I refer on to people I know in the community who are good at doing that. Something to think about, something to talk about with your clinician. And from La República de Dominica, yo estoy diciendo, I am saying, have an amazing day.